Got it. Got it. When it comes to the actual prosthesis itself,
Mm.
again, are there any limitations to that in terms of what you can and can't put in, or again, are all options open?
No, I mean the implant, it looks fairly generic compared to most implants that we use for hip replacement surgery. The socket, yeah, is identical. It's a standard. I use an uncemented socket, so it's a two-part socket made out of a metal outer shell, which has what we call a hydroxyapatite coating. This is a crystalline coating that the bone has a great affinity for. The socket is implanted into the pelvis as a jam fit, so it's a secure fit from the start, from the end of the operation. But then over time, a few weeks, the bone grows onto the surface of the socket and secures it into place. Inside that fits a liner piece, which is the actual bearing surface. There are options. You can use ceramic, you can use, again, polyethylene. On the thigh bone side, this technique is easier if we use an implant which has more of a sort of a curved banana shape to the stem. Some implants that are routinely used are a much straighter implant. They work perfectly well. It's just technically more difficult to put that sort of an implant in using the anterior approach compared to an implant which has a sort of a curved shape to it, and it curves as it goes into the bone. It fits the bone that way much more easily for this technique. But the technology is fairly straightforward. We can use, on the femoral side, cemented or uncemented implants, depending on the patient's age and bone quality. And the uncemented implant, again, fully coated with hydroxyapatite to encourage bone growth onto it. The cemented version, a polished metallic component, which has the typical taper slip principles for a standard cemented implant, and it works very well.